All right, everyone, welcome back to my channel. So I'm finally back in office. I am 3 weeks, just over 3 weeks post-op laparoscopic gallbladder surgery. This video is for those who are over a week out, 2 weeks, close to 2 weeks, and they're ready to create some movement in their body. They're starting to feel stiff. Um, Lots of times what I am noticing and what I noticed myself with my clients is we will sometimes guard this area. So maybe, you're a little rounded or protecting those incisions. You have every reason to, because we want to keep those closed. We don't want those areas opening. So today is just going to be about kind of moving through what we're feeling in our body. I'm going to go ahead and expose my tummy so you can see what's going on my body, and I'm going to encourage you to do the same thing. Make sure that you're clean. So go ahead and, if you haven't taken a shower, wash your hands, wash your belly off. So this is to kind of help get us moving. So depending on which laparoscopic you've had, you might have an incision up here that's a little bit higher. You can barely see mine anymore. You might have one that's up higher, or if you've had a laparoscopic for intestinal stuff, yours might be down lower. What I've personally found is that the muscles underneath are getting tighter. So, like rectus abdominis here, you can see from the sternum all the way down to the pubic bone. Both of these sheath-like muscles come straight down. And then here on the sides, we've got the internal and external obliques. They go both directions. So one is shaped one way and one is shaped the other direction. And then we've got the deeper muscles, so transverse abdominis. Those are a little bit thinner. Usually most people don't use those muscles as much, but they are part of the core, and they're the main one that I always recommend trying to activate when you're first learning how to use your core. Today we're just going to create a little bit of movement, and I want to create a big heaping warning here is that if you feel pain, there's a good sign that is not something you need to be doing. So I want you to listen to your body and go very slowly. So you'll watch me and I'll go really slow. You'll probably see me go further than what you can go because, again, I'm 3 weeks post-op. So I've had my post-operational visit. So I've been clearanced to exercise, whereas you may not be. If you're only a week or two out and you're just starting to feel stiff, that is who that is for. This is who this video is for. So if you see me going a little further than what you can, by all means, stop at what feels where you need to stop for your body. But being a manual therapist, being a massage therapist, there's a couple things I want to show you guys before you start moving again, and a way to learn how to connect with your body a little bit better. So we're actually going to use our hands today, and I want you to go ahead and put your hands on your stomach, just kind of right in the middle. And again, you want to avoid your incision sites if they have not closed, especially if the glue is still on there. You're likely that, we're going to cause problems if we start poking around too hard or start rubbing. So today we're not going to do any rubbing. I will make a second video for those of you who are recovering and have the bulging that is happening around the incision sites. I'll make a video for how to get that scar tissue and keloid type tissue out, or at least smooth it out a little bit. Today we're just going to feel with our hands, and we're just going to poke right in. So I'm kind of following the edges of my rib cage here, and I'm going to kind of go right in the center, right where rectus abdominis is. And you can do this sitting up or laying down. When you're sitting up, you're going to be engaging. And if you're anything like me, 2 weeks post-op, it's hard to sit up. So feel free to lay down. And again, keep in mind where those incisions are. We're not trying to feel any pain around the incision. We want the skin to close all the way. So here we're just feeling the muscle, and we're just kind of going in. And I want you to notice what you feel as you're breathing, and then kind of start to move in a little bit. Notice if you feel tightness. If you've just eaten, you're going to feel stuff in there too. This is right up below the stomach. So you might feel some food digesting in there as well. And I just kind of want you to be aware of what feels tight. So for me, I knew already my right side body was always tight before I even got the surgery. And now it's very tight. So I'm having to work on that a little bit more. So we're just kind of feeling around. Again, avoiding the incisions. So I'm going to go lower than my incisions, lower than my belly button line. If you have your incisions lower, you're just going to fill up a little bit higher. Take a couple of deep breaths if you can. Looking for any tight muscles, maybe start to feel closer towards that belly button. Rock a little side to side as long as that's not moving the skin so much that's you're feeling a pull sensation on the skin. Deeper is fine. And then maybe go out a little bit towards the edges of that rectus abdominis. Okay, and we'll just use one hand. I'm going to start on my right side, so I'm going to use my left hand, and I'm going to kind of reach across here, and I'm looking for kind of where the rib pokes out here at the bottom. You'll feel it on your side, and we're going to go from here, and we're going to start going towards the belly button medially, towards the belly button. Again, avoiding those incisions. It's very, very close to the incisions. So again, if you want to do this laying down, and we're just going to feel what muscles are tight. And I'm just going to start moving in a little bit. Just breathe. And when you breathe, sometimes you'll feel your own muscles push back on you. That's what we're looking for. And maybe you notice that one feels tighter than the other. My right rectus abdominis is so much tighter. Been doing this for a very long time, so I can tell immediately. And then we'll go to the left side. So you use your right hand right underneath where those ribs are. And we'll just kind of poke in there. We're not rubbing or anything, right? We're just pushing in. Noticing if there's any extra tension as you breathe. Good. So I can tell my left side is not as tight as my right, and it definitely is for me. It's rectus abdominis. I feel like, especially with the gallbladder surgery, if you have an incision up here and in the belly button, that's two scopes that they had to put through that rectus abdominis muscle. And if you did it on the right side as well, if you have two incisions here, that whole right side is going to be a little more tight and guarded. And so just feeling around gives us a sense of what muscles we're dealing with, and then how painful are those incisions. So if the incisions are really painful and you go to try and move, we're going to split those incisions open. And so I want to caution you, we're going to go really slow today, and we're going to just feel how things feel as we go. We're going to start with a couple of movements. You guys have maybe heard of a cat-cow motion. It's where we're rounding the back, right? And then we're arching the back. The arches, for me, were the hardest part because it's stretching that skin open, and it's stretching really deep into the tissue where where the gallbladder was removed. We've had an entire organ, or some organs if you've had lower things removed. And so we're just going to start with that simple motion, and starting kind of with a neutral spine. If you can, sit upright, make sure your feet are flat on the floor, and we'll just round the spine a little bit. And maybe you can go all the way. You can round all the way down and back up. And we'll start to kind of arch the back. Maybe the eyes go up a little bit, the chest arches and pushes forward. And I can get to about right here now before I would not have been able to do this. And then back again. And I start to feel a little pull at this top incision. So this one's not quite healed all the way through. So I'm going to be doing some more manual therapy on that in the next video to help you guys with that if you're having that issue as well. Back and down. And you're always going to do this just kind of within a normal range of motion for you. Make sure everything feels good. Rounding. And coming back up. So 5 or 6 rounds of that ought to be enough to warm us up. I'm going to scooch over to the side here so y'all can see my back. And we'll kind of do the same motion with the pelvis. So we're going to round out the low back. Hands can stay on your knees or your shins or your foreleg. And we'll arch. So we're just kind of rocking really gently forward and back. And this should be a little easier if you've had the gallbladder surgery. This one might be a little harder if you've had anything lower done. Just take about 5 or 6 rounds of that and go nice and slow. Breathe as deeply as you can. I know it's hard the first week or two to really get a big breath. And so you're just going to go to where you can go to. If you can fill up all the way, or if you have to pause just before that, that's what we have to do. But breathing will help to stretch this inner cavity out. Good. And then we'll come back to center here. And we'll do a couple other motions side to side. So I'm going to take my hands on my lower ribs here. And I'm just going to imagine my ribs are sliding to the right and sliding to the left. And sometimes the hips will want to move as well. So you can put your hands on your hips and just kind of guide your hips to stay put while your ribs move. And I'm trying to make my movement a little bit bigger so you can really see what I'm doing. But you may not move this far. This is, especially going to the left, creates some compression. Going to the right might feel good if you've had the gallbladder surgery because it's opening it, right? But we're trying to avoid anything that feels like pain. A deep stretch, fine. But again, if it feels bad to you, don't do it. It's not worth pulling those stitches. So just a little right to left motion. Do 1 or 2 more. Hopefully that feels good on your shoulders too. Breathing. Very important. Now come back to center. And we'll kind of do the same thing with the hips. So we'll let the hip draw up and down, up and down, up and down. So if I'm standing, it's going to look a little more like this, right? I'm bending one knee and then straightening the other. So if that's a little more convenient for you, you can stand, bend, and straighten. I get a nice little stretch along here. I would encourage you all to, go ahead and poke around and touch areas that you feel that are tight. And as long as it's not painful, you're fine to poke around in there. Listen to what your body is saying. So this causes me a little bit more discomfort because this right side is so tight. So I'm going to hold my left side, my left hip up, and I'm just going to hold there for a second. I'm going to find a little spot in here, and you can pretty much do this with any of these motions. You're going to find a spot that's maybe tense. So this is my rectus abdominis here. Let me see, now I lost it. Where did it go? And we're poking straight in, so we're not trying to pull the skin. There's one. This is the one that really bothered me. I'm going to use my left hand, so it makes it a little easier, and then you can brace with the other hand. I'm above my top incision. I'm below my top incision here, and then I'm above this bottom incision. You can barely see it, but it's pretty close. So again, if it's pulling on the skin, just stop. I'm just going to hold. So my left hip is up. My right hip is trying to pull down. And then I'm going to do a couple more motions with that. I might move my rib cage side to side. I might try and round my spine like the cat-cow and arch. That one feels the best for me, is the arching, because we have been stuck in this guarded, this protective range. So opening up feels good. My left hip is still up. My right hip is still down. And maybe you have to do the opposite because of where your incisions are or where your pain is. We don't all have the same thing going on. Good. And then we'll kind of pause there, bring everything back to center, shake it out, do a couple of shoulder circles. Take a couple of breaths and assess how you're feeling. If you need to rest, pause and rest. Let's move on to a couple more areas. So I found that just starting right here in the middle really helped me out a lot. Both hands on the rectus abdominis and doing that cat-cow motion. So kind of rounding in, finding that spot, putting some pressure there, and then slowly trying to come up and back into extension. And again, we're trying not to pull at the incision site. So mine is pretty well healed. So I don't feel any pull from the skin on that incision site, but I feel it in my muscles. And you may not be able to go this far. So you're just gently going to flex, apply some pressure to where the muscles are, and then slowly start to open that chest and just try to keep a little pressure. And you can take breaks. I know that your hands are not used to this, it's harder to do. Just rounding a little, applying pressure. So we're pinning that muscle down so it can't stretch. And then we're opening, so we're stretching the top half of that muscle. Good. We'll shake it out. Shake your hands out if you've been using your hands. And we'll kind of do the same thing. I'm going to pick the same spot because for me, this spot is right in between both of my incision points. And it got so tight in between these two, just again, trying to protect that area, trying to guard it. If yours is lower in between your pubic bone and your belly button, you can apply pressure lower. Again, this one might be easier laying down. The rectus abdominis it goes all the way through, just like that picture that we saw. It goes from sternum to pubic bone. So depending again on where your incisions are and where you're feeling that discomfort. So like my right lower oblique or right lower rectus abdominis muscle is not tight at all down here below the belly button. If anything, this is what I need to tighten. This is the post baby stuff, post core that we need to tighten. So I'm not feeling any discomfort. It's not tight at all down there, but right up here, right above this section inside of these 6-pack abs, one of these is tight. And so I'm going to find my spot. My spot is a little bit higher and to the right. Yours could be here or here or here. It could be really anywhere. And I'm going to take my pelvis and we're going to round it out. So my low back is flattening. And I'm going to push. I'm going to find that spot and push just really gently. I'm not feeling any pull from the incisions. And then I'm going to slowly start to arch my low back. I'm just pushing and holding and creating a little bit of movement. I'm breathing as deeply as I can. Nothing hurts. I'm able to relax my shoulders. And I can feel from the pressure underneath my fingers, I can feel it stretching. When I first started doing this, 2 weeks post-op, I just didn't have time to make the video, but I could not go this far and I could not push this hard. So I am moving more and I am pushing harder than what maybe you'll be able to do if you're only a week and a half or so out. And I really had to be careful around those incisions because they were still very tender. Especially around the belly button gets really tender. This one got really tender on me, this upper one. Good. And then we'll relax. Shake your hands out, make a couple shoulder circles. Okay. We'll do 2 more motions, and that's just to get your core remembering what to do again, loosening it up. So maybe this, whatever's hurting in here, whatever's tense, will loosen up a little more for you. We'll do some lateral flexion. So just kind of leaning over to the side and leaning over to the side. And make sure you're sitting up nice and tall before you start. So get that good posture going. Your pelvis isn't tucked. It's not arched. It's kind of somewhere in the middle. And then lean. And maybe you get a nice little stretch and you want to stay there. You can hold that. You can lean further. Maybe put your arm down and try and reach up with your arm. I found that too much for me. A week and a half post-op, I was not ready to do this. It felt good to move my arm, but I could not lean over any further than this. So if you can't go this far, you just can't. Take your time, and then we'll go back the other direction. Maybe just start with a little lean. Maybe feel a little pull, and you'll just stop. When you feel that little pull, that's all we need to do. This is not a pain game. And then I'm going to reach because I can really feel like I need to reach through this right side. Make sure that hip stays down when you go to lean. Sometimes it'll want to pop up on you. And we'll do that, 2 more times, just right to left, a little lean. Pause there if it feels really good. So mine's over on the left. I'm feeling more pull on the right. You can stick your hand in there again if you'd like. Come to center, put some pressure on that spot and then start to lean. That will pull open that section that you're pushing on. It opens up the tissue around it. Back to center. Last time. Then we'll come back. We'll shake it out. We'll do another motion here, just a little bit of a twist, thinking about the twist coming from your upper body. And you can use your arms to stabilize you down here, but I'm not putting any weight on my fingertips. And I'm not forcing a twist, right? Because I want to be gentle. And then just going over to the left. And again, I couldn't go very far the first, after a week or so. But this, today I can go a lot farther than I ever could. And I don't feel any pain deep inside like I did. So I know those stitches have healed. Where they made their incisions on the arteries have closed. If you're not cleared for exercise, you're just going to slowly turn. Good. All right, back to center. Last one, we'll kind of slump over. You can have your forearms on your shins or your knees if you'd like. But I would recommend just start to fold all the way over yourself. Let your low back open up and round back here. If it doesn't hurt your belly, you can also widen your legs and let your belly fall through your thighs as you try and just stretch out that low back. I'm going to pull my shirt down here. And when you're down here, if you can touch the floor, you can. If you can't, that's okay. Then we can, go a little bit to the right. So I'm bringing my body over my right knee. And then I'm going to bring my body over my left knee. And just go really slow because you might feel a pull before you get to that point. I know I did. And I feel more of a pull on this right low back. This is where everything was tight on me at. So if you need a pause on the left side or the right side, do that. Listen to your body. I'm just here to give you some pointers, give you some tips to get you moving again and get some of the muscle tissue to open back up after this surgery. Come up nice and slow, roll up the spine. Good, you guys did great. I will see you all in the next video. We'll go over how to do some massage around this tummy area and get some of these incision sites a little bit more comfortable with opening and healing a little bit faster.